Today we are joined by Dr. Landon Trost. Dr. Trost is a board-certified urologist practicing in Utah. He specializes in fertility and Peyronie's disease. He is a well-published author and researcher and has been involved with the development of several urologic devices in the erection space. Dr. Trost is joining us to share his expertise in some of the topics that men worry about the most, leading to anxiety and performance issues. Dr. Trost, thank you very much for joining us.
Well, my pleasure. Thanks for having me, Mark.
So today's topic is about penis and erection length, what's considered normal, what can be done to address concerns about men who feel like or may actually be too small. Before we get into the topic, though, can you share with us just a little bit about your practice?
Yeah, so previously I was up at Mayo Clinic in Rochester and was the head of andrology there, which basically specializes in everything male fertility and sexual medicine. So erectile dysfunction, testosterone, Peyronie's. As the practice grew, we brought on more people on board, and I started to subspecialize just in Peyronie's disease and male infertility. And about 3.5 years ago, left to start our own practice at my wife's request, just because of how busy things were at Mayo. And so now we just treat Peyronie's disease and male infertility.
Okay, we are, advocates of relationship health as well. So we can definitely appreciate, you having to make a move to accommodate family and relationship needs. Now, Dr. Trost, what is considered a normal size, a normal length, and a normal girth of an erection?
Well, it's kind of a tougher question to answer accurately, just because when you look online, like let's say you go into Google and you type that in, you'll get these various algorithms and they'll say, roughly 5 inches is kind of a normal penile length, 5.1 inches or somewhere in there. And, the standard deviations, 5th and 95th percentiles down in the 3 range and up in the 6 range. But it's tough because it depends how you measure it. And measuring a true erect length is really difficult to do. And so usually in the office, we'll use a surrogate, which is stretch length. And the way that technically we try to keep it standardized is we push all the way to the pubic symphysis. And then we'll go out toward the head of the penis, towards the rim or the corona, and we'll call that the length. But so you have to keep that in mind. When you're looking at anything online, what's the method that they use? Did they go to the tip? Did they push the kind of that suprapubic fat pad in? Or are they just looking at visual erect length? Because a lot of times when someone feels like they've lost length, they're talking about like the visualized portion that they see with an erection or flaccid, but they're not necessarily looking at the true stretch length if you pushed all the way into the pubic symphysis into the head. So I know that's kind of a roundabout answer, but it's tricky. It also matters regionally. Like if you look at someone from kind of Southeast Asia versus Europe versus Africa versus North America, you're going to get different lengths as well. So, what is normal? Well, what's your background? What's your heritage? And, what have you had done? Do you have diabetes? Have you had a prostatectomy? Do you have Peyronie's disease? There's different normals within each of these categories.
Yeah, tremendous amount of variation. So, Dr. Trost, I just want to be curious here for a moment. You spoke about that sometimes the additional length could be like not necessarily visible. When it comes to sexual activity in particular, let's say vaginal intercourse, does that length show up, so to speak, in penetrative sexual activity, or does it remain basically a non-entity in the sexual activity?
Yeah, usually it will show up in the sense that if you push in that suprapubic fat pad, it's a real flexible area. And, the older men get in general, or more obese or things like that, that will become more prominent and will make it visually look, not as noticeable. But again, yeah, with actual functional intercourse or penetration, a lot of times that gets corrected as far as once that area gets pushed in. And it depends on how severe. Morbidly obese is going to be a kind of a different picture compared to someone who just has lax skin or just kind of age-related sagginess of that area.
But you're saying, generally speaking, there is some flexibility there. So not everything is as it may seem, and there may actually be more length in a penis or an erection, I should say.
Yep, almost always there is. Someone will come in and say, "Oh, here's my measurement," and we do a measurement, and we find out it's actually an inch or two longer just because of the way of measuring.
Well, it's really important to hear, and hopefully some of our listeners are already going to feel some relief just knowing that they probably have been measuring incorrectly if this is an area that they are concerned about. Now, in terms of girth, are there any specific numbers out there? I assume that it also probably varies depending on how you measure and population and heritage and whatnot. But are there any specific numbers our listeners should be aware of?
A good rule of thumb is it's usually about a half inch less than your length. So if someone's 5 inches in length, then usually their girth is about 4.5 inches. And so that's kind of your standard. If you said, well, what's a someone who's done measurements on this, what's the average that you're looking at? You're probably looking about 4.5 inches is a good kind of middle of the road girth. But girth is real tricky too. So even in scientific papers, we don't even accept papers that list girth because it's just so unreliable. If someone gets a really rigid erection, they're going to have a different girth compared to someone who gets a partial erection or doesn't get one at all. And so it's really difficult to measure.
And that's circumference that we're talking about. Is that correct?
That's correct. Yep.
Now, there are some conditions that can really impact penile length or appearance of penile length. Can you tell us a little bit about what is a buried penis? What is a micropenis? Are they the same? Or are these two different conditions?
Yeah, and these are, again, real challenging terms because you'll see them in blogs and you'll see them on Facebook and Reddit and things like that. And oftentimes there isn't like a standardized definition. So buried penis, most often when we talk about it from like a sexual medicine standpoint, it's where the penis goes into the body so severely that a lot of times it gets entrapped in there and can't come back out. And a lot of times this starts with real severe obesity where the suprapubic fat pad kind of pushes out on the penis. And then what happens is urine gets on that skin scars, and the penis can no longer come out. And it can be a huge problem. I mean, you can get anything from fungal overgrowth to infections to pain to loss of penile skin and so on. So that's kind of a true buried penis. Now, there's different degrees of it. So, of course, you can have like a partially buried penis or one that retracts and then comes back out when you push on the area. But a true buried penis is that. Micropenis is, I think, a way overused term in adult urology. True micropenis is talking about kind of a pediatric condition in someone who never underwent puberty or had very minimal growth with puberty. And so when you see a true micropenis, I mean, literally you're talking about maybe 1 inch and not because of a fat pad, like the fat pad's normal, but the penis is like 1.5 inches or so. And they look like pediatric penises. The girth is very minimal. That's a true micropenis. You don't see it very often in adults, though.
Because you're saying that's a very rare condition.
Yeah, and again, people will use different definitions. They'll say, well, if you're below the 5th percentile, we'll call that micropenis. But true micropenis is really kind of a pediatric diagnosis that you get when you don't go through puberty and you don't get development of the penis, either because of a receptor issue or hormones or whatever.
Yeah, and certainly I think what you're sharing is correct, that the terminology is thrown around probably a lot more than the actual condition exists.
That's correct. Because even if you take those percentages and say, hey, I'm below the 10th percentile, well, that's for adults. But if you included true micropenis in there, you'd have a limb that skews way down. It's not that common. And so it doesn't factor into any of these studies when we look at measurements.
Got it. Now, men notoriously underestimate their own size. What percentage of men fall into a problematically small penis category? And I understand the caveat that problematic is somewhat subjective, but something that would fall into a category where urological intervention may be indicated or necessary.
Well, I think if you use that definition where you said, we need to intervene, true problematic is probably under 5%, if even that. But like you mentioned, really, when someone comes to see you, one of the first things I ask on my intake questionnaire is, well, what bugs you? What are your goals and what bothers you the most? Because I found most men compare it as a relative term. So what were they before? And someone can be 7 inches now, but if they were 8 before, they're going to feel like they're much less. Whereas if someone was 3 before and they're 3 now, they're going to feel just fine for it. Sometimes people will define that off of partner comments. One of the most hurtful things I think that some of these guys come in with is if a partner says, well, I can't feel you, or this is your problem type thing. That becomes that sticks in their mind, and it becomes something that they get fixated on and is really difficult to treat. So, some people will say, well, I can't have intercourse in certain positions. And so then technically that's a functional problematic, issue. But it really comes down to patient perceptions and desires, I would say, more than anything else.
And you see the most common issue that's presented is not something that is, let's say, objectively or categorically a problem, but a lot of it has to do with the distress, the anxiety, the worry associated with either a perception issue or partner feedback or some kind of loss of length over time. I would assume due to just aging or some kind of medical condition. Can I ask you to speak a little bit toward that last category? What would cause loss of length? If, aside from measuring discrepancies, what would actually account for a legitimate loss of length?
I'd say probably the most common one that you see is either going to be obesity, which would be one where it's more of a perceived, loss of length, or diabetes, where it is a true loss of functional length. And with diabetes, you tend to get a change in the elastic tissue and it becomes more fibrous. So instead of the penis being an elastic, stretchable organ, it now is more scarred in. And so you don't tend to get nearly as much expansion in girth or diabetes or in length. Aside from that, Peyronie's disease is clearly one of the most common, causes of loss of length. And some men there will lose 1 to 3 inches, so really dramatic and significant amounts. And then there's debatable areas like post-prostatectomy. Someone gets their prostate cut out, and the far majority will perceive and will say that they've lost length. When we do actual length measurements, we don't see any true loss of length. And then there's kind of more rare subcategories, people who get recurrent priapism, who get scar tissue in there, people who do self-injections and it causes scar tissue to form. Those certainly occur, but they're less common than these other ones.
Yeah, so it sounds like if we were breaking these down into categories, there is perceived without actual loss of length because of things like obesity, where again the body has kind of grown over or absorbed a little bit of the penis, but the length is still there. Then there's like actual loss. It sounds like it's really all due to scar tissue, whether it's Peyronie's or diabetes or whatnot, some kind of additional rigidity that doesn't give the penis the elasticity to expand to its original length. And then there's like what sounds like something along the lines of body dysmorphia, where like people are imagining that their penises are shorter, oftentimes post a medical procedure, but there's no actual evidence to support that, and measure studies would indicate that nothing has actually been lost.
Yep, I think that's a good summary statement for sure.
Okay. Now, in your opinion, as a urologist who has treated probably a lot of men over the years, generally speaking, for a healthy man who falls within the 95 percentile, is size something that men should really be worrying about? Like, how much does this actually matter?
Well, I think it kind of depends on their social situation. So typically when couples have been coupled for a long time and they're sexually intimate partners for many years, usually the answer is no. If anything, length tends to be problematic. And again, it kind of depends. In cases of a heterosexual couple, the increased penile length, the penis can hit the cervix, and that can cause a lot of pain. But girth tends to be more important there. With gay couples, on the other hand, with penetration in particular, sometimes length, girth, and rigidity are really important aspects. And so a lot of it depends on the, where you're starting from and what the goals are with it. Now, in younger men, so those who are kind of 20s and 30s, and especially those who have multiple partners, they tend to be in this paired atmosphere much, much more. And so for them, it can be a real significant issue because the person they're with may have had multiple partners in the past month. And so they may have kind of direct comparisons compared to someone who's been with one partner only for 30 years, So that's where it really does come down to what are the patient's objectives and goals, what's their background, what's important to them, to see, is this a true issue or not?
Okay. I was just saying that let's say a man who has a 4-inch erection, which again was within the standard, within that 95 percentile, but would be to the smaller side. So if it's a younger man who's not in a long-term partner relationship, there is a comparative nature, which there's nothing wrong per se, but he may be concerned about partner reactions. The partner may have had experiences with men who are larger and may comment or may be less satisfied as a result.
Yeah, and this is just one of, you could name pretty much anything in the body. You could say bicep size, pectoral size, hair growth, all of those things. There's multiple ways that people will compare among others in the area, and penile length is certainly one of those. But when you say from a functional standpoint, at 4 inches, it's a non-issue, because from a penetration side, if anything, again, on the heterosexual side, it ends up being a negative when you talk about length compared to girth. Again, from a gay standpoint, it would be very different. So a lot of it just depends on which. Yeah, exactly. Yeah.
Some men are certainly interested in ways to lengthen their penis. Is this something which is even possible? And if so, how is this done?
Yes, it's possible. And there's different ways of looking at it. You can go, the surgical route, which almost nobody recommends. And if you find someone who does recommend it, be real wary of it. Where basically you can cut the penis all the way around, lengthen it, and then put a graft in between it. The problem with surgery is it has a lot of real severe complications. And so you tend to do something like that in real extreme cases if you're already putting a penile implant in, for example. When you look at the non-surgical side of it, there's certainly a million things out there on the internet. The only thing that has reliable and consistent data is penile traction devices. And those are just like they sound. It grabs the head of the penis and it stretches it. And they certainly can work. I mean, you typically see about an inch increase in length with them. Ongoing length is achievable as well, but it tends to be really slow after that initial stretching of it.
Okay, so you're saying a man who's dedicated to increasing their length could potentially add up to an inch, but it's a slow process.
Yeah, most studies would say after about 3 months of use, you gain about an inch, and then any ongoing use of traction beyond that will be maybe a quarter inch or something. And I think that first 3 months, it's basically stretching ligaments and kind of stretching things out. And then ongoing use is where you actually get new growth of nerves and tissue and things like that.
Okay. So Dr. Trost, if a man has a small flaccid penis, but a normal erection, meaning we'll even give him a 6-inch erection. So he's above that average number. He's on the higher side of the standard deviation, but he's distressed by this. Is this considered an issue that would be addressable by, let's say, a traction device or surgery, or is this just a normal part of being a human being?
So if he's satisfied with the erect length, then traction probably isn't the best option for him. I mean, traction's meant to lengthen things. When you see a normal erect length, but a retracted flaccid length, that usually is something we call hard flaccid syndrome, which is basically someone who's real anxious or has a high adrenaline type state, where it kind of pulls in that smooth muscle. And that results in a more kind of firm with flaccid, sometimes pain, and contracted penis. But when they relax, when they have a normal erection, everything expands to its normal length.
If a patient comes to you and they are distressed about the size of their penis, but again, we'll say this patient is in the normal standard deviation, how do you distinguish between like a length issue and body dysmorphia?
Yeah. Well, true body dysmorphia is a condition where they don't have insight into their condition. So they don't recognize that they are essentially kind of wrong about it, So they're the type that'll come in and say, hey, can't you see that indent right there? Can't you see that vein right there? And we're both looking at the exact same thing. And no, I can't see anything abnormal. And they're the type that will, I have a couple patients like this. They'll email me at least weekly and say, I have a real severe curve. You can see it right here. And I look at the picture and it's perfectly straight. And so that's true penile dysmorphia or body dysmorphia type disorder. They don't have insight into their condition. When you look at, length loss, of course, that's due to some underlying cause, and that can be an issue. Guys who don't have true penile dysmorphia, you'll come in and they'll say, hey, I've got a 50-degree curve. I say, well, send me pictures and I'll do a measurement and we can kind of talk more about that. They'll send the pictures and they'll say, well, it doesn't show it in this picture. And so those are ones that are probably more anxious as opposed to, true penile dysmorphia or true, Peyronie's disease or some other condition like that. So you can kind of break it into different groups on the anxious versus penile dysmorphia versus a true condition.
Okay. And what if it's though just by length? Let's put curvature on the side for a moment. If a guy comes in and says, I'm too small, my penis just doesn't make the cut, and like it's clearly not the case, but he's distressed and he is of the belief that he has a self-diagnosed micropenis.
Yeah. Well, and that's where I think it depends on what they were previously. If someone comes in and says, hey, this is how I was before, now I've changed and I'm here, that's a little bit different than someone who has always been here and they feel they're really, really small, but in reality they're large. On the latter one, that's more like the penile dysmorphia, and that's more of a psychological condition, needs to be seen and evaluated and treated along those lines. Someone who was at one area and then decreased, that one you treat more as like an organic, what can we do from a length restoration standpoint.
Okay, so you're saying the real differentiator is if a guy comes in and says, "I've always been this size, nothing's ever changed, it's just become distressing to me now." That would be something that would fall a little bit more on the psychological side, as opposed to somebody who's been through some experience, probably physiological, that has caused actual loss of lengthening or actual loss of penile length. Is that correct?
Yeah, so you take a condition like diabetes or Peyronie's or whatever, and say someone was 7 inches and they came down to 5.5, that's going to be real distressing for them. But if someone comes in at 7 inches and says, "Hey, I'm really small, I need to lengthen," then that's going to be more the psychological side of it, where there's this discrepancy between reality and perception.
Yeah. Now, how exactly does this traction device work?
So most of them will basically secure the head, because the head is attached to the corpus cavernosum, or kind of the rigid part of the penis, and then push against the base of the body. So it's just like the rack from medieval times. It grabs the penis and stretches it. And this type of thing has been done for literally hundreds of years. I mean, there's pictures of people putting rocks on the penis in some tribes in Africa to lengthen and extend the penis. So it's not a new concept at all. And it's the same as almost anything else. Braces, you can straighten teeth, scoliosis, you can kind of bend things with traction devices. And so it's a known and established concept within medicine.
Okay. And then lastly, what are the reasonable expectations? I know you mentioned like that initial inch. Is that something that's the high end, or is that something that a man could expect by using a traction device? And then secondly, what are the rates of success, not just measured by actual lengthening, but also by patient satisfaction post using one of these devices?
Good question. So we've done a couple randomized controlled trials in certain populations. So we've done it specifically in Peyronie's and post-prostatectomy in men with diabetes. We haven't done it in like a dysmorphic type population. And so I think the answer to that question would be very, very different depending on the group. On the Peyronie side, generally, there's a high satisfaction as far as the improvement. And in the study that we did, it was 94% increased in length, and the average was one inch roughly. And it ranged from anywhere from about a third of an inch all the way up to 2 inches plus. And what I found is it depends on your baseline length. If you're real long to begin with, then you tend to get more to the 1-2 inches. If you're real short to begin with, you tend to get to the 1/2 to 1 inch type area for it.
In other words, you're saying the extension is almost like a percentage, much more than it is actual amount added. Is that correct?
That's correct. Yeah, and it tends to be in that 10% range. Tends to be a good kind of rough number to put your hand on.
Okay, and then in terms of patient satisfaction, do you have any data that's been collected on that? Are people generally satisfied, or do they say, I thought it was going to be way bigger and it just didn't quite move the needle, at least get experientially?
Yeah, and we do. In all of our studies, we're real focused on the subjective side of it, because that's ultimately what matters. Regardless of what we put down on an objective measurement, it's how much does this impact the person. And with the traction, generally it's been high. So I mean, you generally have 85+% that say they do it again and they're satisfied with it. When you look at how much did it improve it, it usually is a split. It's around 30-40% say a dramatic amount, 30-40% moderate, and then 10-20% that'll say it's minimal improvement with it. So, and then of course the remainder don't get any improvement. So generally it's high. But keep in mind, whenever you go into a study, you like to feel like what you just did was worthwhile. Mm-hmm. So I have a feeling that if you took a true to life sample, it'd probably be lower than what you see in studies.
That makes sense. Let me just wrap up with one final question. Mm-hmm. So if there's no loss of length versus a man who has experienced, let's say, certain man who's experienced, say, Peyronie, some kind of scarring, is there a difference in outcome? And then is this device okay to be used by a man who has no loss of length, but just would like to try to lengthen the penis?
We haven't studied it specifically in someone who's just trying to lengthen. We've only looked at it in disease states. So I can't answer it from an accurate kind of scientific standpoint. There's not any danger. Like we haven't seen anything that's been, dangerous on that end. And in general, those who have more severe disease have a tougher time restoring length, because there's more significant scar tissue there. So those who have kind of a lesser disease overall generally experience, more length improvement. So I would guesstimate that, those who just wanted to primarily lengthen would probably do better than someone like these hard to treat groups, because Peyronie's diabetes and post-prostatectomy are generally considered some of the hardest to treat groups out there.
Well, Dr. Trost, thank you very much. This is really informative, and this information is so important because there are so many men out there that do worry about length. Think about it. I've worked with patients who are obsessively preoccupied and concerned with this. I know that it gets in the way of relationships and partner sexual activity, and I think having just good, accurate information from somebody like yourself who's really in this space is going to be helpful for the listeners to hear. So I appreciate your time and appreciate you joining us. Hope to have you back soon for an episode again.
No, my pleasure. Thanks, Mark.